we shall talk about certain MCQs here now based on this musculoskeletal system. Dear students, the first question is here for you. I shall read out the question. Total number of bones in axial skeleton of children: A 80, B 87, C 206, D 100. In axial skeleton of adults now, in axial skeleton of adults, 80 bones are present, and in appendicular skeleton 126 bones are present. So total 206 are present in the adult. 206 are present in the adult. Whereas in children here now, axial skeleton comprises of 87 bones. Total number of bones are 350. So 87 are axial skeleton. Then remaining 263 are present in appendicular skeleton here. Okay, remaining 263 are present in appendicular skeleton here. So appendicular skeleton you find 263 in children. In axial skeleton you find 87. Altogether 350 bones are present in the entire endoskeleton of children here now, whereas in adult 206 bones are present. So as per the question, the answer is 87. That is answer B is the correct answer. I will read out the question number 2 for you. Type of skull in human being: A monocondylic, B dicondylic, C tricondylic, D tetracondylic. There are two kinds of skull in vertebrates, monocondylic and dicondylic. The skull with single occipital condyle is monocondylic, and the skull with two occipital condyles is dicondylic. So in human being and all mammals now, in all mammals including human being, and in amphibians, the skull is dicondylic, whereas in fish, reptilia and apes, it is monocondylic. So skull is dicondylic in human being. So the answer is B for this. Answer is B. And the question number 3, Vomer belongs to A skull, B vertebral column, C girdles, D ribs. Vomer is one of the bones of the face here now. So the answer here is A skull. So question number 3, answer is A. Now the question number 4, the smallest bone of the face: A zygomatic bone, B lacrimal bone, C nasal, D maxillae. So the lacrimals which are there at the base of the orbital fossae, they are the smallest bones in the human skull here now. So the answer is B for question number 4. Here is the fifth question here now. Vertebral formula of human being is A C6T12 L5 S5 C4, B C7 T12 L5 S5 C3, C C7 T12 L5 S5 C4, D C8 T12 L5 S6 C7. Now here I know very well students now, in human being cervical region 7 vertebrae are present, thoracic region 12 are present, lumbar region 5 are present, sacral region 5 are present, coccygeal region 4 are present. Okay, coccygeal region 4 are present. So as per these options here now, answer C is the correct option here now. Answer C is the correct option. Now sixth question is for you. The smallest bone in the human body: A maxilla, B malleus, C incus, D stapes. Remember, the smallest bone in the entire human skeleton is stapes that lies in the middle ear, and the longest bone is femur. So the answer is stapes, D. Now the seventh question is here. I shall read out for you. Odontoid process belongs to A humerus, B atlas, C axis, D cranium. Odontoid process is a peg-like projection of the second vertebra, that is axis, by means of which it is connected to atlas to form pivot joint here now. So the answer is C axis. Now question number 8. Ribs are connected to the sternum by A. Cartilage, B. Bones, C. Vertebrae and D. Muscles. The ribs here now, 1 to 7 ribs are called vertebrosternal ribs. They are connected to sternum by costal cartilage. They are connected to sternum by costal cartilage, which is a modified hyaline cartilage. So the answer is A. For 8th question, the answer is A. Now 9th question is here. The false ribs are A. 11th and 12th pair, B. 8th to 12th pair, D. 8th pair to 10th pair, D. First 7 pairs. Dear students, ribs are of 3 types in human body here now. 1 to 7 pairs are true ribs, or you call them sternovertebral ribs, where they arise from vertebral column and attach to sternum. 8th, 9th and 10th are false ribs because they are attached to the cartilage of 7th. They are also called vertebrochondral ribs here now, and 11th and 12th are floating ribs. So as per this question here now, the false ribs are 8th to 10th pair. 8th, 9th and 10th pair are false ribs. They are also called vertebrochondral ribs. So the answer for this question, 9th question, is C. Now the question number 10 is before you. Students, I shall read out for you. The scapula belongs to A. pelvic girdle, B. humerus, C. pectoral girdle, D. cranium. Like in human being, pectoral girdle consists of only 2 bones. One is scapula, the other one is clavicle. So the answer here is C. pectoral girdle. So for 10th question, answer is C. pectoral girdle. Now I shall read out the 11th question for you. The S-shaped bone of pectoral girdle is A. coracoid, B. scapula, C. clavicle, D. suprascapula. Like in the pectoral girdle, the scapula is blade-like, whereas the clavicle is S-shaped. So the answer for this is C. That is, clavicle is S-shaped in pectoral girdle. Now 12th question, number of bones in the forelimb: A. 30, B. 87, C. 14, D. 8. So forelimb here now, how many bones are present in human being? Forelimb consists of humerus 1, each forelimb if you take, radio ulna 2, carpels 8, metacarpals 5, phalanges 14. So you total up all this, you get 10, 15, 19, 29, 30. So each forelimb is made up of 30 bones. So the answer is A. Question number 13. The largest foramina in the skeleton, he is asking the foramina in the entire human skeleton here now. A. foramen magnum, B. occipital condyle, C. obturator foramina, D. acetabulum. In the entire endoskeleton, if you take, obturator foramina is the largest foramina, but if you take skull, it is the foramen magnum. So as per this question here now, the answer is C, that is obturator foramina is the correct answer. That is lies in the pelvic girdle of human being here. 14th question is here. Phalangeal formula of hand is A. 2, 2, 3, 3, 3, B. 2, 3, 3, 3, 3, 3, C. 2, 3, 2, 2, 3, D. 3, 2, 2, 2. What is phalangeal formula? Phalangeal formula always tells us about fingers. That is, in human being, how five fingers are present. 1, 2, 3, 4, 5. These are the fingers here now, where the first one is the that is thumb here now. Now thumb has 2 phalanges, second finger has 3 phalanges, third finger has 3 phalanges, fourth finger has 3 phalanges, fifth finger also has 3 phalanges. So except thumb here now, all the remaining fingers have 3 phalanges each. So the answer is 2 and 4 threes. 2 and 4 threes. So the answer is B. Now here is the 15th question. I shall read the question. Number of bones in the lower limb. That is asking the number of bones in the hind limb of human being. A 23, B 40, C 30, D 80. Now here dear students, in hind limb how many bones are there? We shall just count and see once. So you'll get to know the answer. In the thigh region, how many bones are present? Only one bone, that is femur, one bone. In the shank, how many bones are present? Two bones are present, that is tibio and fibula, 2. In the ankle region, tarsals are 7, that is calcaneum, talus, cuboid, 3 cuneiform bones, 1 okay, the 7 tarsals are present, ankle region. Then sole, metatarsals are 5. Then in the toes, the number of phalanges are 14, and one kneecap, that is patella, is 1. So total, if you total up here now, 15, 20, 27, 29, 30. So each hind limb is made up of 30 bones. So the answer is C for this. Now question number 16, actually read out for you. Autoimmune disease among these: A. Osteoarthritis, B. Gout, C. Rheumatoid arthritis, D. Bursitis. Among these students, rheumatoid arthritis is an autoimmune disorder where the antibodies are synthesized against the tissues of the joints, which cause the degeneration of the tissues of the joints. As a result, there will be inflammation and painful swelling of the joints all over the body. So the answer is C for 16. Now 17th is here. I shall read the question. Progressive damage of neuromuscular junction, weakening and paralysis of skeletal muscles are the symptoms of A. Gout, B. Hematiated disc, C. Myasthenia gravis, D. Osteoarthritis. In myasthenia gravis, now there will be weakening and deterioration of the skeletal muscles due to excess secretion of acetylcholine at neuromuscular junctions now. So the answer for this is C. Myasthenia gravis. Now 18th is here for you. Friction is lessened in ball and socket joint by A. mucin, B. synovial fluid, C. coelomic fluid, D. cerebrospinal fluid. In all the joints now, the synovial fluid acts as a lubricant. So the answer for this is B. synovial fluid. Next is 19th question. I shall read the question for you. Rigidity in the muscle is called A. hemophilia, B. rheumatoid arthritis, C. muscular atrophy, D. rigor mortis. Dear students, you have learnt already this concept here now. Rigor mortis is a condition where all the body muscles become rigid here now because of interlinking of cross bridges with actin filaments and due to deposition of excess amount of lactic acid. Notice soon after death of a person, the rigidity of the muscle soon after death of a person is called rigor mortis. So the answer is D. 20th is here. The number of muscles in the human body: A. 206, B. 639, C. 40 and D. 100. In human body approximately 639 muscles are present. So the answer is B. 21 is here. In the diagram skull, what does A represent? Here A. occipital bone, B. frontal bone, C. parietal bone, D. temporal bone. Here the bones of the cranium are given in the diagram here now. Yes, students, you have learnt already that cranium consists of 8 bones here now, where the frontal bone forms the forehead, the parietal bone forms the upper part and roof of the cranium, then the temporal bones form the lateral part of the head, lateral part of the cranium, occipital bone forms the hind part of the cranium. So here A is representing the forehead, so obviously the answer for this is B. frontal bone. 22nd question. Here is a question. Consider the parts labeled as A, B, C, D and E respectively in the diagram and fill out the correct sequence. A. superior costal face. superior articular facet, lamina, pedicel, superior vertebral notch. B. Lamina, pedicel, superior vertebral notch, superior costal facet, superior articular facet. C. Superior costal facet, pedicel, superior articular facet, lamina, superior vertebral notch. D. Superior vertebral notch, superior costal facet, lamina, pedicel, and superior articular form. Here in the diagram here now he is talking about the structure of a typical vertebra, where A is the centrum or the body here now. Then you can see the superior costal facet, then you have pedicel, then superior articular facet, lamina, superior vertebral notch. Okay, so here the answer is C for this, Now here is 23rd question. I shall read the question for you students. Choose in the correct statement among these the layman's term growth plate when referring to the bone as epiphyseal plate is composed of cartilage. B. The skull, the ribs, the sternum or in the appendicular skeleton. C. Material stored in the bone include the material calcium and phosphorus and organic macromolecular fat. D. The well-developed bone in the pectoral girdle of human being is called scapula. Okay, so the correct statement among these is, so the as per the question here now, the correct statement is D. The well-developed bone in the pectoral girdle of mammals is scapula. All the other statements are wrong, whereas the D is correct. So the answer for this question is D. 24th question here. I shall read the question for you. Choose the correct statement among these. 1. Force produced by whole muscle in its contraction is termed as tension. 2. Tension and load are opposing forces. 3. Isometric contraction include tension increased with change of length in the muscle. So the correct options are A. 1 only, B. 1 and 2, C. 3 only, D. 1, 2, 3. So as per this, only first and second statements are correct. The third statement is wrong. So the answer is B. 1 and 2. 25th is here. Assertion: skeleton helps in blood cell formation. Reason: blood flows through skeleton. A. Both assertion and reason are true and reason is the correct explanation. B. Both assertion and reason are true but reason is not the correct explanation. C. Assertion is true but reason is false. D. Both assertion and reason are false. E. Assertion is false but reason is true. So among these, assertion is true. Skeleton helps in formation of blood cells because it has got bone marrow. Bone marrow acts as hemopoietic tissue, helps in formation of RBCs. Okay. Then second, reason, blood flows. Blood does not flow through the skeleton here now. So the answer is assertion is true but reason is false. That is, answer is C for this. 26th is here for you. Skeleton serves as a storage depot. Reason: skeleton stores carbohydrates and proteins. A. Both assertion and reason are true and reason is correct explanation. B. Both assertion and reason are true, reason is not correct explanation. C. Assertion is true but reason is false. And D. Both assertion and reason are false. E. Assertion is false but reason is true. Among these, skeleton serves as storage depot for RBCs. Storage depot for which one? RBCs. And it also stores fat, that is yellow bone marrow is a kind of fat, so it can be called storage depot for RBCs and fat. The reason, if you take stores carbohydrates, so carbohydrate part is wrong. So the answer is assertion is true and reason is false. So answer is C for this. 27th is here. Muscle twitch is related with tetanus. Reason: tetanus is caused by many nerve impulses at a time. A. Both assertion and reason are true, reason is the correct explanation. B. Both assertion and reason are true and reason is not the correct explanation. C. Assertion is true and reason is false. D. Both assertion and reason are false. E. Assertion is false but reason is true. Here muscle twitch is related with the tetanus. Twitch is a single contraction elicited in the muscle by a nerve impulse, that is by threshold stimulus, can be called twitch. And when many stimuli are given one after the other, it leads to tetanic, that is sustained contraction, which is called tetanus contraction. And reason, tetanus is caused by many nerve impulses at a time. So here answer can be B, that is both assertion and reason are true, but reason is not the correct explanation. So 27th answer is B. 28th is here for you students. Assertion, after strenuous exercise, athletes are liable to much more oxygen debt than non-athlete. Reason, athletes training enhances the capacity for aerobic contraction of the muscle. Both assertion and reason are true, and reason is the correct explanation. B, both assertion and reason are true, but reason is not the correct explanation. C, assertion is true, but reason is false. D, both assertion and reason are false. E, assertion is false, but reason is true. After strenuous exercise, athletes are liable to much more oxygen debt than non-athlete. Okay, assertion is correct because after strenuous exercise, the amount of oxygen absorbed by them is more. You get rid of the lactic acid as they go on, okay, performing that strenuous activity for a longer time. The entire glycogen or glucose gets converted into lactic acid here now, and to get rid of lactic acid, usually athletes, before the completion of the strenuous event, they inhale more amount of O2 to clear up that oxygen debt. So assertion is correct. After strenuous exercise, athletes are liable to much more oxygen debt than non-athlete is correct. Reason, what reason is given? Athletes training enhances the capacity for aerobic contraction of the muscles. Okay, when athletes when they take part in any strenuous physical activity, the muscles start synthesizing ATP by aerobic method rather than anaerobic method. So both assertion and reason are true, but not the correct explanation. So you shall go for B, that is both assertion and reason are true, but reason is not the correct explanation of assertion. So answer for this is B. Yeah, 29th is here for students. I shall read the question. Assertion, bicep and tricep are called antagonistic muscles. Reason, this is due to the fact that they contract and relax together. A, both assertion and reason are true, reason is the correct explanation. B, both assertion and reason are true, reason is not the correct explanation. C, assertion is true but reason is false. D, both assertion and reason are false. E, assertion is false and reason is true. We take assertion here now, bicep and tricep muscles are antagonistic, that is the correct assertion, because one helps in flexion, the other one helps in extension. Bicep helps in flexion of the forelimb, tricep helps in extension of the forelimb, so they are antagonistic to each other. Reason, this is due to the fact that they contract and relax together. Reason is wrong, so the answer is assertion is true and reason is wrong. So answer is C for this. 30th is here. Assertion, in arthritis, movement at the joints may be immobilized. Reason, any mechanical injury and defect in the ligament can cause displacement of the bones from their normal position. A, both assertion and reason are true, reason is the correct explanation. B, both assertion and reason are true, reason is not the correct explanation. C, assertion is true, reason is false. D, both assertion and reason are false. E, assertion is false but reason is true. The answer is B, because both assertion and reason are correct but not correct explanation to each other. So the answer is B for this. 31 is here. Assertion, muscle as a whole does not obey all or none law. Reason, each muscle fiber contracts maximally whenever it contracts. Okay, assertion and reason are true, reason is the correct explanation. B, both assertion and reason are true, reason is not the correct explanation. C, assertion is true but reason is false. D, both assertion and reason are false. E, assertion is false and reason is true. When looking at assertion, students, muscle as a whole does not obey all or none law. It's correct here now. The entire muscle does not obey all or none law. In the muscle here now, only a bundle of muscle fibers, that is fasciculus, obeys all or none law, but not the entire muscle body. So assertion is correct. Reason, each muscle fiber contracts maximally whenever it contracts. That is also correct, but it is not correct explanation to each other. So the answer for this is answer B is the correct answer. Thirty-two is here for you. Match the following. Skeletal portion, table 1, table 2, number of bones. Skull 14, cranium 29, facial region 8, axial skeleton 80. The students will try to find out the answer here now. Now the skull, how many bones are present here now? Skull has got, okay, cranium, 8 bones are present, face, 14 bones are present, hyoid, 1 bone is present, ear ossicles, 6 are present. So this is the total number of bones in the cranium. So it amounts to 14 plus 6, 20, 28, 29. 29 bones are present in the skull. So B is the correct option for skull. Then I take second one, cranium. I have written already 8 bones are present. So the option here is C. Next 3, facial region. Here I have written already 14 bones are present. So the here option is A. 4, axial skeleton. In the axial skeleton of human being, 80 bones are present. So the option is D. So the answer is 1B, 2C, 3A, 4D. Okay, 1B, 2C, 3A and 4D. So the answer for this is B. 33 is here. Master following again, table 1 and table 2. Table 1 here now, you have the muscles which are antagonistic to each other, and table 2 the character. Table 1 it says flexor and extensor. Number 2 adductor and abductor. Number 3 elevator and depressor. Number 4 pronator and supinator. In table 2, brings towards or away from the middle line of the axis. B elevates or depresses the tongue. C bends apart over another. D rotating apart like forearm to bring the surface upward or downward. Let's try to find out the answer. Students, table 1 if we take is talking about flexor and extensor. Flexor and extensor. Flexor extensors are the muscles which help in folding and stretching of the a part of the body here now. So among these, brings towards and away from the middle line, bends apart over another. So here one is C. C is the correct option, that is bringing apart and over another, like bringing a part of the body over and each other. The next second one is talking about adductor and abductor. Adductor and abductor. Adductor muscles are the muscles which bring a part of the body towards the median axis, abductor away from the median axis. So here A option is the correct for this. And third is talking about elevator and depressor. Elevator and depressor. Elevators elevate a part of the body, depressors depress a part of the body. So among these here now, elevator or depressor of the tongue. Tongue is either elevated or depressed. So B is the correct answer for this. And the fourth one if you take is talking about pronator and supinator. Pronator and supinator are the muscles which keep the hand, okay, and palm stretched either forward or backward or upward or downward. So the correct option among this is D. So the answer is 1C, 2A, 3B and 4D. So the answer for this is 1. That is A. So 34th is here for you. Choose the correct match among these. You have got 3 tabular form matching here. Character, red muscle, white muscle. Number 1, other name, red muscle, anaerobic muscle, white muscle, aerobic muscle. Number 2, myoglobin, red muscle more, white muscle less. Number 3, diameter, red muscle small, white muscle big. Number 4, glycogen, red muscle sparse and white muscle abundant. Okay. So among these here now, the red muscle is aerobic muscle, white muscle is anaerobic muscle. That is the wrong option here now. Remaining options are correct. Red muscle has got more amount of myoglobin, white muscle has got less amount of myoglobin. Red muscles are small, white muscles are large. Red muscles have less amount of glycogen, white muscles have more amount of glycogen. So the answer is C for this. That is, except first option, remaining options are correct. So the answer is C. 35 is here. If one end of fractured bone is forcibly driven into the inferior of the other one, it is called A. green stick fracture, B. impacted fracture, C. stress fracture, D. comminuted fracture. The students, you already learnt about this. Green stick fractures are mostly noticed in the children before attaining adolescence now, where one bone is fractured, the other bone is bent. Impacted fracture, where one bone pierces into the other one. C. stress fracture, where the bones develop fissures. D. comminuted fracture, where the bones, the splinters of the bones are noticed at the site of injury. So among these, the correct answer is B, that is impacted fracture. 36th is here for you. Inflammation in the joint is called A. fracture, B. arthritis, C. fever, D. anemia. So inflammation of a joint, okay, which either leads to burning sensation and stiffening, can be called arthritis. So the answer among this, correct answer among this is B. Now 37th is here. Choose the incorrect statement among these. A. joint surface in male skeleton is larger than female. B. pelvic brim of female is larger than males. C. coccyx is less movable in male than female. D. acetabulum larger in females than males. So among these, the incorrect statement is D. Now 38th is here for you. Pisiform bone belongs to A. ear, B. forelimb, C. pectoral girdle, D. skull. Pisiform bone is one of the carpels, it lies in the wrist region of forelimb. So the answer is B. 39th is here. Match the following. List 1. Os cordis, 2. Os penis, 3. Os rostralis, 4. Os falciparum. And the list 2 you have A. palm of mole, B. penis of rodents, C. heart of deer, D. snout of pig. Now you have options A. 1C, 2B, 3D, 4A, B. 1A, 2C, 3B, 4D, C. 1C, 2B, 3A, 4D, D. 1D, 2A, 3C, 4B. Now you should try to find out the answer, students. Now the first one, under list 1 he is given. One is given os cordis. Os cordis is a tissue that is ossified, lies in the heart of ruminants, lies in the heart of ruminants. So the answer here is C, that is, he says heart of deer. Os cordis is a visceral bone here now, that is the visceral tissue which is deposited with calcium form. It is present in the heart of ruminants. So the answer is C, heart of deer. Next is os penis. Os penis is the ossified penis found in rodents, okay, and dogs and all that, So second one is B is the correct answer. And third one, when you take os rostralis, that is the rostrum is completely ossified. It is also a modified visceral bone where the rostrum is ossified. Os rostralis is present in snout of the pig. So that is os rostralis. The answer is D, that is that of pig here now. The next you have fourth option, os falciparum. Os falciparum is the palm of mole. The palm of mole is also completely ossified. It is also a visceral bone. So A. So the correct answer is 1C, 2B, 3D and 4A. So the answer for this is A. 48th is here. Horseshoe shaped bone among the following: A. malleus, B. lacrimal, C. cranium, D. hyoid. Here hyoid bone is horseshoe shaped. It lies in the floor of the buccal cavity. it provides surface for the muscles of the floor of the buccal cavity here now. So the answer is D. I shall read out for you. That one question here is a question for your students. Which one of the following is the correct matching of the three items and their grouping category? Under item, you have A, ileum, ischium and pubis, B, actin, myosin, rhodopsin, C, malleus incus cochlea, D, malleus incus cochlea. Under grouping, coxal bones of pelvic girdle, muscle proteins, pyrimidines, ear ossicle. So among these, the correct answer is A, because ileum, ischium, pubis, they form the coxa of pelvic girdle. So the answer for this is A. Yeah, 42 question is here. Elbow joint is an example of A, hinge joint, B, gliding joint, C, ball and socket joint, D, pivot joint. So elbow is an example for hinge joint. So answer is A. 43 is here. In a hurdle race, what is the major energy source of leg muscle? A, preformed ATP, B, glycolysis, C, pyruvated lactate, D, oxidative metabolism. In a hurdle race or any kind of strenuous activity, pyruvic acid and lactic acid are the recurrent sources of energy. They are broken down anaerobically to generate more and more amount of ATP quickly. So the answer for this is C. 44th is here. Dark bands are A band, B band, C, I band, D, Z line. Dark bands are also called A band, that is anisotrophic band. So the answer is A, anisotrophic band. 45 is here. Upon stimulation of skeletal muscle, calcium is immediately made available for binding to the troponin from A, blood, B, lymph, C, sarcoplasm, D, bone. Calcium in the muscle is always stored in sarcoplasmic reticulum. So upon stimulation from sarcoplasmic reticulum, there will be diffusion of calcium ions to bind with troponin. So the answer is C, sarcoplasm, sarcoplasmic reticulum, sarcoplasmic reticulum. 46 is here for you. Energy is stored in liver and muscle in the form of A, carbohydrate, B, glycogen, C, fat, D, protein. In human body, the carbohydrates are stored in the form of glycogen and the immediate source of energy for the muscle contraction. So the answer is B, glycogen. 47th is here. Connection of the bone to bone is by A, cartilage, B, tendon, C, muscle, D, ligament. Yes, students, bones are connected to each other by ligament and muscles are connected to bones by tendons. So the answer is D, that is ligament. 48th, the Paget's disease is caused by A, prolonged deficiency of vitamin D in adults, B, abnormal bone resorption by abnormal osteoclasts, C, excess alkaline phosphatase, D, excess production and abnormal organization of collagen. Resorption of the bone is called Paget's disease. So the answer is B. 49th is here. Glenoid cavity is associated with A, scapula and humerus, B, scapula and femur, C, acetabulum and humerus, D, acetabulum and femur. Glenoid cavity is a socket of scapula to lodge the humerus. So the answer is A for this, that is scapula and humerus. 50 is here. Which one of the following sets of ions are essential in the chemical event for muscle contraction? A, Na and K, B, Na and C, that is sodium and calcium, C, calcium and magnesium, D, sodium and magnesium. Here for the muscle contraction, calcium and magnesium ions are essential. So the answer is C for this. 51. Read out the question for you. Muscles get fatigue due to accumulation of A, lactic acid, B, ATP, C, phosphate, D, carbon dioxide. Fatigue is mostly due to accumulation of lactic acid and depletion of all the energy resources. So the answer for the 51 is A. The joint between carpals is A, gliding joint, B, hinge joint, C, saddle joint, D, pivot joint. Between carpals and now the joint is gliding joint. which is also called arthrodia. So the answer for this is A, gliding joint. 53 is here. Number of cervical vertebrae in human: A7, B5, C12, D10. In human being and all mammals, irrespective of the length of the neck, the number of cervical vertebrae is 7. So the answer is A. 54. Number of cervical vertebrae in mammals: A7, B8, C12, D6. I made a mention just now, in all mammals including human being, irrespective of the length, the number of cervical vertebrae is 7. So the answer is A. 55 is here. Inflammation of joint due to accumulation of uric acid is called A, gout, B, myasthenia gravis, C, osteoporosis, D, osteomalacia. Accumulation of uric acid results in gout. So the answer is A. 56. In human body, which one of the following is anatomically correct? A, collarbones 3 pairs, B, salivary gland 1 pair, C, cranial nerves 10 pairs, D, floating ribs 2 pairs. So among these, the correct option is D, floating ribs. 11th and 12th are called floating ribs. There are 2 pairs. Remaining options are wrong. So the answer is D for this. 57th is here for you. I shall read out. The shoulder blade is made of A, clavicle, B, humerus, C, ilium, D, scapula. The shoulder blade is also called scapula. So the answer is D. 58 is here for you. Bone becomes fragile in A, gout, B, osteoporosis, C, arthritis, D, none of the above. So in osteoporosis, there will be fragility of the bone due to loss of calcium content. So the answer is B. 59 is here. The longest bone in human body is A, femur, B, radius, C, tibia, D, fibula. The answer is femur. Femur is the longest bone in the human endoskeleton, and the smallest is staphoidal bone. The strongest is mandibular bone. So the answer is femur. That is A. 68th is here. Accumulation of which of the following in muscle causes fatigue? A, acetic acid, B, carboxylic acid, C, hydrochloric acid, D, lactic acid. Accumulation of lactic acid and depletion of energy resources results in fatigue. So the answer is D. For 60th question, answer is D, lactic acid. 61. Achilles tendon is associated with A, gluteus muscle, B, hamstring muscle, C, quadriceps muscle, D, gastrocnemius muscle. Achilles tendon is due to inflammation of gastrocnemius muscle of the calf. So the answer is D. 62 is here. Functional complex of the muscle fiber is A, muscle, B, bundle, C, fascicle, D, both B and C. So here the functional complex of the muscle fiber is fascicle, that is a bundle of muscle fibers. Okay, the fascicle is the answer. So answer is C. 63 is here. Striped muscles are A, syncytial, B, uninucleate, C, spindle shaped, D, none of this. The striped muscles are skeletal muscles. Skeletal muscles are syncytial in human body. So the answer is 63. Answer is A, that is syncytial, that is without cross walls, that is multinucleated. The muscles are multinucleated without cross walls. 64 is here. Henson's discs are found in A, myofibril of unstriated muscle, B, myofibril of striated muscle, C, myofibril of heart muscle, D, B or C. The striations, dark bands and light bands are found in heart muscle and even in the skeletal muscle also. So the answer is the myofibril of striated muscle and myofibril of heart muscle. The answer could be, so the answer is D for this. 65. The phosphogen that helps regeneration of ATP from ADP during muscle contraction in vertebrates is A, ADP, B, inositol phosphate, C. Arginine phosphate, D. Creatine phosphate. Dear students, you know very well that in all vertebrates, the phosphogen in the muscular tissue is phosphocreatine, whereas in invertebrates it is phosphoarginine. So the answer is phosphocreatine or creatine phosphate. That is answer for this question is D. 66. During fatigue, A. Muscles fail to relax. B. Muscles fail to be stimulated. C. Blood circulation in the muscle stops. D. Motor nerve does not respond to muscle. So the correct answer, muscles fail to be stimulated because of depletion of energy and accumulation of lactic acid. Muscles stop responding to the motor nerves. Muscles stop responding to the motor nerves. So the answer among these is, the correct answer is B. Muscles fail to be stimulated. Answer B. 67th is here. You shall read out. During contraction of skeletal muscle, calcium ions bind to A. Actin, B. Troponin, C. Tropomyosin, D. Myosin ATPase. Calcium ions bind to troponin complex. So the answer is B. 68th is here. Striated muscles contract because of A. Sliding of myosin filaments on actin filament, B. Sliding of actin filament on myosin filament, C. Actin filaments come closer to each other, D. Myosin filaments come closer to each other. Here during sliding filament theory, actin filaments slide over myosin filaments. So the answer is B. Sliding of actin filaments over myosin filaments. So the answer is B for this. 69th. The contractile protein of skeletal muscle involving ATPase activity is A. Myosin, B. Troponin, C. Alpha-actinin, D. Tropomyosin. In skeletal muscle, myosin has ATPase activity. So the answer is A. For 69th question, answer is A. 70th is here. Smooth muscles are A. Involuntary spindle-shaped uninucleated tapering, B. Voluntary multinucleated cylindrical, C. Involuntary cylindrical multinucleated, D. Voluntary branched and uninucleated. So among these, the correct answer is A. That is, smooth muscles are involuntary and they are spindle shaped, uninucleated and tapered. So the answer is A. 71 is here. Cardiac muscles are sensitive to A. Mechanical stimuli, B. Chemical stimuli, C. Electrical stimuli, D. All of this. Cardiac muscles respond to all kinds of stimuli. At the same time, even they respond to even orthorhythmic stimuli. Orthorhythmic stimuli, the stimuli which are evoked within the cardiac muscle by means of pacemaker. So the answer for this is D. That is all the above. 72. A cricket player is fast chasing a ball in the field. Which one of the following groups of bones are directly contributing in this moment? A. Pelvis, ulna, patella, tarsals. B. Sternum, femur, tibia, fibula. C. Tarsals, femur, metatarsals and tibia. D. Femur, malleus, tibia, metatarsals. So in this, among this, the correct option is C, because the bones of the hind limb are involved. C option, when you see students, tarsals are present in ankle, femur is present in the thigh region, metatarsals are also present in ankle region, tibia is present in the shank region. So the correct answer among these options is C, that is tarsals, femur, metatarsals and tibia. 73 is here. Stimulus several times greater than threshold is provided to a muscle. It will A. Undergo tetany, B. Contracts slightly, C. Contracts forcibly, D. Contracts with the same force. Muscles always obey all or none law, that is a muscle fiber obeys all or none law, or a bundle of muscle fiber obeys all or none law. When the stimulus is of threshold level, the contraction will be the same. So the answer is contract with the same force even if the stimulus is slightly higher than the threshold. So the answer is D. 74th is here. I shall read out the 74th for you. Number of vertebrae present in cervical, thoracic, lumbar, sacral and coccyx region of human being respectively are, okay, in human being, a vertebral column consists of cervical region 7 vertebrae are present, thoracic region 12 are present, lumbar region 5 are present, sacral region 5 are present, and coccygeal region 4 are present. So that is the correct sequence here now. 7, 12, 5, 5, 4. Where all the 5 are fused to form 1, 4 are fused to form 1 in adult here now. So among those options here now, the correct answer could be C, that is 7, 12, 5, 1 and 1. Answer C. The 75th question we shall read out. Neural canal is present in A. humerus, B. tibiofibula, C. cranial bone, D. vertebral column. Neural canal is present in the vertebral column. The vertebrae, if you take here now, they have dorsally a neural arch and ventrally centrum. Between these two, there is an aperture called neural canal, which is meant for the passage of spinal cord. So the answer is D. vertebral column. Answer for 75th question is D. vertebral column. 76th is here for you. I shall read out the question. Which of the following form thoracic cage of man? A. ribs and sternum, B. ribs and thoracic vertebrae, C. ribs, sternum and thoracic, D. ribs, sternum and thoracic vertebrae. So the answer for this is D, that is ribs, sternum and thoracic vertebrae constitute the rib cage or thoracic cage. So the answer for this 76th question is D. Now 77 is here. In mammals, lower jaw is made of A. medulla, B. maxilla, C. mandible, D. ethmoid. In mammals and human being, the entire lower jaw is made of a single bone called dentary bone. So dentary bone or mandibular bone. So the answer is C, that is mandible. Now 78 is here for you. Lower jaw of man is made of A. one bone, B. two bones, C. three bones, D. no bone, only muscles. Lower jaw in human being is made of a single bone. I have made a mention already. It's called dentary or mandibular. So only one bone. The answer is A. Now 79 is here. Hyoid bone is located at A. front of the skull, B. behind the skull, C. top of the buccal cavity, D. floor of the buccal cavity. Hyoid, which is dagger shaped bone here now, lies in the floor of the buccal cavity, provides surface for the muscles of floor of the buccal cavity here now. So it lies in the floor of the buccal cavity. So answer is D for 79th question. 80 is here. I shall read out the question. Acetabulum occurs in A. cranium, B. vertebrae, C. pelvic girdle, D. pectoral girdle. In the pelvic girdle, ilium, ischium and pubis, all three of them collectively form a socket called acetabulum to enlarge the head of femur and to form ball and socket joint. So the answer is pelvic girdle, that is C. 81 is here. Consider the diagram given below. Parts labeled as A, B, C, D and E respectively indicate A. ilium, femur, tibia, fibula and sacrum, B. pubis, femur, tibia, ilium and sacrum, C. ilium, femur, tibia, pubis and sacrum, D. pubis, tibia, femur, ilium and sacrum. When you look at the diagram, students, here now, supposing you take A, where is the A labeled here now? A is indicating the pubis part of the pelvic girdle. So A indicates the pubis part of the pelvic girdle. Next B is representing the femur. Then you have C is representing the tibia, that is tibia and fibula are present in the shank region. So C represents the tibia. Then you have next D represents the iliac bone, and you have next E is representing the sacrum, that is sacral vertebrae are labeled there as E. So the answer for this is B, that is pubis, femur, tibia, ilium and sacrum. So for the 81 question, the answer is B. 82 is here. I shall read out the question for you. Name the part of the body which have single pair of bones. A. wrist, B. lower jaw, C. external ear, D. pelvic girdle. Part of the bone which have single pair of bones. So in the pelvic girdle there are two identical halves where each identical half is called os coxa. In os coxa, ilium, ischium and pubis are present where they are single, and similar bones are repeated in the next os coxa of the pelvic girdle. So the answer is D, pelvic girdle. '83 is here. Metabolic arthritis is commonly called A. Gout, B. Cancer, C. Rheumatism, D. Tuberculosis. Metabolic arthritis is also otherwise called gout. It is due to accumulation of uric acid. So the answer is A. Now 84th question here now. Assertion: inflammation of skeletal joint may immobilize the movements of the joint. Reason: uric acid crystals in the joint cavity and ossification of articular cartilage may lead to this. A. Both assertion and reason are true, and reason is the correct explanation of assertion. B. Assertion and reason are true, but the reason is not the correct explanation. C. Assertion is true, but reason is wrong. D. Both assertion and reason are wrong. So the correct answer here is A, because inflammation of the skeletal joint may immobilize. When there is inflammation of the joint, it results in immobilization of the joint. That inflammation may be because of deposition of uric acid, or may be because of drying up of the synovial fluid. So as it is given in the question here, uric acid crystal also may cause immobilization of the joint. So the answer is A, that is both assertion and reason are true, and reason is the correct explanation. So for 84th question, answer is A. Now 85th question here now. Hinge joint is present in our body between A. thumb and trapezium, B. humerus and scapula, C. first and second vertebra, D. humerus and radio ulna. Among these, D is the correct answer, because humerus and radio ulna, there is a hinge joint which is also called elbow joint here now. So the answer for this is D. 86th is here. The largest muscle in the human body is A. gluteus, B. stapioidus, C. sartorius, D. masseter. Gluteus maximus of hip region is supposed to be the largest muscle in the human body, and the smallest is stapioidal muscle of the middle ear. So the largest is gluteus maximus, that is A. So 86th question, answer is A. Now 87 is here. How many bones are present in the human skull? A. 32, B. 28, C. 12, D. 42. Human skull comprises of about 28 bones, where cranium consists of 8 bones, face consists of 14 bones, then there is one hyoid bone, and there are 6 ear ossicles. All of them put together constitute 28. So human skull consists of 28 bones. Answer is B. 88 is here. Knee joint is A. synovial joint, B. fibrous joint, C. hyaline joint, D. cartilaginous joint. Knee joint is the best example for movable joint or diarthrodial joint or synovial joint. So the answer for this is synovial joint. Now the 89th question is here for you students. It's before you. I shall read the question for you. When the body part moves towards the median axis, it is called A. pronator, B. adductor, C. abductor, D. supinator. The muscle which brings a part of the body towards the median axis is called adductor, and away from the body is called abductor. So both of them are antagonistic to each other. So in this, according to this question, the answer is adductor. That is one which pulls the body towards the median axis. So answer is B for 89th question. Which of the following pairs is correctly matched? A. hinge joint between vertebrae, B. gliding joint between zygapophyses of successive vertebrae, C. fibrous joint between phalanges, D. cartilage joint between skull bones. So among these, the correct option is gliding joint between zygapophyses of successive vertebrae. Remaining options are wrong. So the answer for that is 90 question is B. gliding joint between zygapophyses of successive vertebrae.